Thank you. It is 1 p.m. It is the official start of our meeting of the Advisory Stakeholder Group for Autism-Related Needs. We're still a few short and people generally trickle in over the first few minutes, so I want to give it till 1:05, 1:10 at the most, depending on how many people come in, how quickly. Can everybody hear me now? And can they hear me when I mute?
Yes, I can hear you.
And did I go muted when, oh, Lisa, and did I go properly mute when I was?
Yes, you did, Victoria.
Okay.
Victoria, give me 1 sec because I'm jumping in. It looks like we have people in a Google Meet. So I'm going over to the Google Meet right now to tell them to come over to the Zoom. So I have both windows open. If you mind just, sorry, everyone, if I can't mute one screen and the other. So if everyone in this Zoom can stay quiet for the next 10 seconds, then I can tell them to jump over. Thanks, everyone. All right, everyone's been notified in the other room, so we're good to talk on here. Thanks, everyone. I appreciate it.
No problem. Google Calendar automatically creates a Google Meet link unless you try hard and remove it. So that maybe is able so we put the Zoom link. LS will be sending also an email to all the membership. Sorry about that.
I do that all the time, where it automatically Teams, and then I don't know where.
And Outlook is just as guilty because it will create a Teams link.
Exactly, I know.
And you know what's really funny is that some people seem to have no problem accessing the Google, even if they're outside of the state system, and other people have to be admitted, and there doesn't seem to be any rhyme or reason to that.
That works. Yeah, I've noticed that. Okay, I'm gonna give it, since we had that little technological snafu, I'm gonna give it to 110 before we start, to make sure we have a full quorum without needing to worry about it. That everyone who's coming in. And Ellis also sent an email to all the membership asking reminding that it's the Zoom link sent with the agenda last night.
Mm-hmm.
It looks like we still have Nicole and Ryan in the Google room.
Ellis, could you go to that?
Of course. See you all in a
Thank
moment.
you.
I'm actually glad that things are starting a couple minutes later. I just got in from some other meetings, so. It's nice to
The
take it.
story of our lives, meetings.
Yeah, what would we do without Zoom? We'd be on the road a lot.
Or we'd probably be scrambling around a lot.
Maybe, hi, Adam. Good to see you.
Good to see you.
I think I know where you are.
Yes, obviously.
I've left a couple of messages for your mom. I would love to have a chance to talk with her. So let her know that I've called, okay?
That's been kind of busy lately and tired.
Yeah, I can understand it'd be a busy season. Yeah.
Oh, yes. Well, I mean, she had just finished with a sale down in Kensington recently. So she really wasn't in the mood to, carry, talk at the moment.
Oh, I can understand. Just let her know I've been thinking of her.
Of course I will, Mrs. Prince.
And how ready are we? Lisa and Ellis, what's the status of the?
So I was monitoring the Google room. Everyone has left the Google room. So if you feel like you're ready to take roll and see if we have a quorum, that's
Okay,
for you to decide.
awesome. That's great. So for a quorum, we need 18 people. We can move forward. We can move forward without a quorum technically, but then some of the rules would be different as far as public records keeping. But I would, for transparency's sake, nonetheless publish them. Okay, as I said, waiting till 110, we're gonna wait that exact minute to see who is straggling behind and go ahead and do that.
Mhm.
I've got one question while we're waiting, if you're still there. How is the state of Maryland looking at Autism Month? As far as the foundation, are you there? Can anybody hear me? Maybe not.
I'm here.
As far as the foundation, our foundation goes, we're calling it Autism Month because we're not trying to say acceptance, understanding, whatever. We want to have it so people can insert where they need to be. If it's in service, if it's in learning, if it is in inclusion, or whatever. How is the state defining it, or are they saying Autism Acceptance Month, or just would like to get a little bit of a feed on that?
I know that the event we're forming part of with the Autism Society and the ARC of Maryland and whatnot, among other organizations that are participating, we're using Autism Acceptance Month.
Okay, what event is that? I haven't heard anything about it.
To my knowledge, it's an event being done in the legislature, but let's touch base on that offline to talk about it.
Okay.
It's on April 2nd. It will be published soon. That's why it's not public knowledge yet.
Okay, I might be at the United Nations, but I'm not sure.
Totally fair. Anyway, let's get ourselves going with this. Can everybody see the screen? I hope just nod along.
Yes, I can see it.
Excellent.
I can
So
see it.
with that, welcome with a slightly late start to the ASGARN meeting for the third quarter of the 2024 state fiscal year. As usual, I'm Victoria Rodriguez Roldan, your friendly coordinator of state autism strategy. I just want to go over real quick over some meeting guidelines. Purpose one is to create a safe, positive, inclusive environment for the advisory group, all the participants, staff, and the public. This meeting is open to the public. Create a safe space for diversity of contributions, thoughts, ideas, and whatnot. And for that, the guidelines that we ask are: assume positive intent on the part of advisory members, moderators, participants, and staff. Always listen actively. We want to allow others to complete their thoughts. Listening to listen, not listening to respond. Don't interrupt. One speaker at a time. If there's like a heated discussion or everyone wants to talk a lot, I will try to prioritize those who haven't spoken yet so that everyone can participate as much as possible with the limited time we've gotten. I do ask everyone to default to both and thinking instead of either or. Things are not in absolutes. And obviously for the members of the public who are not ASGARN members, please wait for the open forum section to speak. I will ask at each slide if there are questions. I will try to keep them timely. Like, for example, if something catches everyone's eye and we have to spend an hour talking, I might be like, okay, that's enough. We will continue it in the open forum just so we can go through the slide deck within the time. We're gonna do a roll call. Ella Sardorian, our new admin coordinator, will be has the magic spreadsheet that adds everyone up. And for everyone's reference, we do have here in the slide deck the list of current members of ASGARN. Ellis, can you start the roll call?
This is Alice. Thank you so much, Victoria. So I'm going to call your name, and if you're here, either say I or put something in the chat, and then I'll know that you're present. And then we'll keep going on. Thank you so much. So Emily Archer.
Aye.
Thank you. Devin Sutherland.
Here.
Okay, thank you. Roger Thibodeau. Thank you. Adam Schaefer-Jones.
Aye.
Thank you very much. Nicole C. LeBlanc.
Here.
Thank you very much, Nicole. Lisa Wiederlight, or is it Wiederlight?
Thank you. It's Wiederlight, but if we were back in Germany, it would be Wiederlight. Appreciate that.
Thank you. Peggy Pugh. Thank you. Christy Russell. Thank you.
No, I'm here. I'm sorry. I had a mute
There
issue.
you are, Christy. Ryan Roddy.
Present.
Thank you very much. Jillian Prince.
Yes.
Thank you. Gregory S. Robinson.
Here.
Thank you. Glad to see you made it. Lydia XZ Brown.
Tragically alive.
Sorry to hear that. Jess L. Wilcox Cowing, Dr. Jess. Thank you. Trevor Bird. Thank you. Nikki Stokes.
Here.
Good to see you, Nikki. Elizabeth Benavides.
Here.
Thank you. Melissa Rosenberg.
Here.
Thank you. Nancy Forsythe.
Here.
Thank you. Yoredi Vasquez Tavares.
Present.
Doctor.
Thank you.
Present. Thank you very much. Rachel Lee Kraus. I see you being present. You see you in the room.
Can you not hear me?
I can now.
It's Leah. I'm here.
Thank you. Delegate Michelle Guyton. Thank you. Delegate Julie Polakovich Carr. Thank you. Fatima Salam. Thank you. Rachel London.
I'm here.
Thank you. Amy Taubenfeld. Thank you. Victoria Rodriguez Roldan.
Present.
Thank you. Carmen Brown. Thank you. Lisa Belcastro.
Present.
Thank you. Courtney Thomas Winterberg. Thank you. Janet Furman.
I'm here.
Thank you. So it appears we do have a quorum. And
Rebecca Rianci is
Ronzi?
raising her hand.
I'm here. I hadn't been called, but I'm here. Present.
Okay, I was reading off of the list. I have a separate spreadsheet. I have you noted down anyways, because I was looking at who was here and who was on my spreadsheet.
Sure. Just
Thank you so much, Rebecca. We'll keep that in mind for future presentations.
And Ellis and Victoria, this is Ray Marshall. I'm here as well. Thanks.
Thank you so much, Ray. I also have you on my separate list.
Thank you.
Thank you. Victoria, I hand
Great.
it over to you.
Thank you. So with that, we have a quorum, and we have an attendance. I just want to open it up. We have been, in this opening remarks, doing a lot of strides towards our goal of submitting a strategic plan as mandated by law at the end of the state fiscal year in June 30th, 2024, which is rapidly approaching. Time is linear yet fast. And I would say we have, in the process of that, been moving with subcommittee meetings, ASGARN, as many of you have been attending. We've been facilitating the subcommittees through a series of very amazing steps, I should add, that have been providing a lot of ideas and recommendations for the strategic planning process. I've had the opportunity to sometimes sit down and review these recommendations before moving forward with them. And honestly, they're a lot and they're great for the most part. It's very good stuff that we have. Like, our biggest difficulty will be not the quality, but the quantity. Like, might be like, oh my God, that's too much to put in one report. Like, but I hope to get there, and we will, as we'll go into detail, the recommendations themselves will be public. And as an update, I want to go into the fact that we, and with special thanks to the General Assembly and the delegates that are here today, that are members of ASGARN, that the statute provides for staff support for this program. And we had finally the opportunity to hire Alistair Dorian as our administrative coordinator. So that of the Autism Strategy Program, and I wanted to just give them the chance to say as little or as much about themselves as they want to introduce themselves. You will probably interact with them a fair bit, like I'm so busy that sometimes that they might have to step in to make sure I answer you, but yeah. Ellis?
Hi, this is Ellis. My name is Ellis Sardarian. I am a Maryland native. I began working specifically with autism in 2015 when I volunteered with Independent of Autism, helping people across the autism spectrum with a variety of ages and support needs. And since then, I have consulted and worked in a variety of different spaces. I am an autistic self-advocate. I have consulted with Slush and Crust, worked with Baltimore City Public Schools, collecting youth feedback and integrating it into educational policy, the Office of Disability and Employment Policy on evaluating disability employment programs, and parent advocacy groups such as Family Voices. I look forward to working with you all to understand the lived expertise of the most impacted. Back to you, Victoria.
Thank you, Alice. Thank you. So with that, I'm going to move, as many of you might remember, in December, we announced that we were going to ask people to provide input and both resubmit what was previously done in ASGARN before my time, as well as submit their own ideas in general of what should be the vision and mission statement of the strategic plan and program. With that, based on the survey responses that we collected throughout January, we did come up trying to balance out. There were a lot of various different perspectives. There were self-advocates, professionals, parents, combinations of all of the above, and providers. So, and there were a whole lot of different ideas, sometimes very different from each other, sometimes focused on let's keep the one that was adopted when it wasn't Gochi, sometimes let's add these massive changes. So I tried to come up with an idea of mission and vision statement that reflected as much as possible this the overall consensus, the stuff that we could agree upon in general, with probably nobody being 100% satisfied or being 100% dissatisfied. And the vision and mission are here in the slide. The mission statement is improving the quality of life of Marylanders on the autism spectrum, as well as their families, caregivers.
Is that something I can put the date, I could put the CPR and the CRN and then put her name?
Okay. The mission statement is improving the quality of life of Marylanders on the autism spectrum, as well as their families, caregivers, and loved ones by ensuring and promoting opportunity, access, and choice so that they can lead healthy, fulfilling, and self-directed lives as integral parts of our communities. And the vision is that we envision a Maryland where people on the autism spectrum, as well as their loved ones, families, and caregivers, experience a high quality of life by possessing the tools to live up to their highest potential and as independently as possible. That is what we will be using, but as part of our guiding stars, as we talked about them in December and in January, and we'll be going forward. I want to see if people have any quick questions, and even if you don't have them or think about them later, we can address it. There will be an overall public discussion section for all of ASGARN members and later a discussion section for the public. So just want to open it just in case. Okay. And like I said, we will have an ASGARN members comment section for open discussion. And we will be sending these slides. Why can't I? Hang on. Why can't I send these slides? Sorry, I lost track of the slide. I just want to go into what is the timeline that we're following. Again, we discussed some of this in the prior meetings, but especially in the more informal January one. In January 2024, as many of you are aware, and this might just come as refresher and repeat, I promise I'm not trying to bore you or any more than I have to. I just want to review, especially for people who are new members of the public and so forth. In January of this year, the subcommittees began their work with a series of regular meetings to draft a report on their subject. There is a workbook, and I've been creating this draft document that all the subcommittee members have been seeing shared on their screens with it. Well, we work around the intricacies of Google Docs and how you can't share documents with everyone in state government and all that. And the idea is, as we go through the various steps, which are like the theory of change, the various policies, not necessarily in that order, developing metrics for success, action plans, policy levers. It's that by mid-April of this year, so next month, we will have a final set, once the metrics section is done, a final report in the form of those workbooks to the coordinator, me, with the recommendations and ideas for the strategic plan. And one thing I do want to make clear is that those recommendation documents will be public as either appendixes or independent links on the website of the strategic plan, so that since there are so many amazing recommendations that not all of them can make them, otherwise the strategic plan would be hundreds of pages. I want to make sure that the recommendations are nonetheless public record that people can use and advocate for, and use the fact that they were recommended by a series of amazing people who are experts in their field, both in lived experience, professional experience, as parents, and so forth. Approximately around Memorial Day, I do plan on taking off that day because it's a state holiday, but you get the point of approximately around that time. The coordinator will have a draft to provide to MDOD leadership. We're hoping to have that around June, and sometime in June, there may be a meeting. We're trying to see if we can squeeze it in. We haven't yet fully figured that out to present in. But the idea is that the submission of the strategic plan will be submitted to the state with the governor's approval, and there will be a big event where you're all gonna be welcome to attend at the end of the state fiscal year. So maybe a few days before, maybe a few days afterwards, you get the point. With the submission, you know, fancy a rollout of the strategic plan. That is the idea. To move forward, the idea of the strategic plan is basically meant to be a comprehensive policy of the state government when it comes to autism needs, to better serve autistic people, their loved ones. And the goal is to ensure promotion of equality for all Marylanders with autism and on the spectrum, like opportunity, access, choice. We've already gone into the guiding stars idea. And it's meant to be that comprehensive policy on all the areas that the subcommittee deals with, like underserved populations, healthcare, education, employment, safety. I can keep on going. I would like to encourage, and no pressure here, because I realize in between the onboarding of Ellis and a whole lot of stuff that we've had to do in the last week, I did not have time to coordinate with the chairs and whatnot to prepare for updates, but I want to encourage either a chair or somebody from the various subcommittees from each subcommittee to give like their own update and their own words of how things have been going. So if we want to start with education, if somebody from education, maybe Roger, Rachel, Jess, somebody who has been, I'm just thinking of some of the more outspoken people, but there have been many members would be interested in talking about how things have been going.
Yeah, I would be happy to jump in. So this is Emily Arker. We have been meeting regularly. We've had really good participation from a variety of members. Our topics have varied all the way from very young children all the way up to how are we going to be providing education and job training and so forth to adults. We've talked a lot about school age individuals and the transition. How are we going to prepare individuals with autism for life after school? What does that look like for preparing for higher education? And what does that look like for more technical training? And we've also talked about college, some of the barriers to getting into college, to making it through college, and some strategies that we can put in place to benefit those with autism across the state.
And I must say it's been a very active group, and there has been a lot of effort in ensuring equality of access and uniform efforts across the state in transition care and so on, transition services. Housing and community integration. Does anyone from that group? I know Lisa is the chair, but anyone else if Lisa can't?
I'd be glad to. I've been really happy about the work that we've been doing. It has kind of dovetailed with a lot of what we did prior to this, but I really feel like it's much more detailed and has really good ideas behind it. We have a great committee. I wish there were more people on the committee. I know people's schedules do and do not sometimes abide by our schedule, but it's been really good. We've been focusing on increasing access to affordable and accessible housing for our population, including, and I'm just going to briefly skim some of the notes that Victoria had sent on our workbook, providing incentives for the housing industry to meet our community's needs, including subsidies for renovating houses that are already built to be made more accessible. That makes them also more affordable than a housing stock and increases availability. Providing subsidies for developers in Baltimore City around vacant homes, specifically making housing available for people with disabilities. And we just talked briefly about exploring possible partnerships with NGOs and other nonprofits, like possibly partnering with Kennedy Krieger or similar institutions, and then considering issues like transportation in the city and employment and food deserts and high crime areas. So it's been really thoughtful. We've been looking at developing partnerships, again, in the community, in addition to looking at regulations and lawmaking, but again, really trying to collaborate with and identifying high level and then community level partnerships to increase the availability of housing for our populations. And then another one would be evaluating the needs and wants of Maryland residents and, of course, resources, both complementary efforts that are happening, current efforts that are happening, and then looking to see the organizations that are providing community integration resources and trying to collaborate with them as well, and what the role of states versus local jurisdictions, and what do some of the local jurisdictions have that are actually working that we might want to look at. And then also perhaps starting a survey of stakeholders throughout the state or regional. Where do we find funding for this, of course, is a big issue because funding is, of course, an issue for everything with our state currently, and not only considering the general fund. Next, we looked at community integration and HCBS, looking at home community-based services funding, and of course, increasing the amount of direct support professionals who can help people in their homes stay in their homes and assist with supported living. We've talked about, again, emphasizing community integration and what policies encourage people to be able to live independently, and how housing factors into isolation currently from networks and the lack of integration, including, especially including rural areas. In the interest of time, we have a lot on this, which is really amazing. We were looking also at communications and public education. So looking to publish a neuro-inclusive housing white paper to help those who are outside of the housing bubble understand this target market better so they can serve our communities' needs better. For people to be educated on their rights as potential tenants and landlords and property managers around disability rights specifically. Educating Maryland Home Builders Associations, real estate investors associations, and those so they can better understand their community's needs. And then again, we have really great ideas about that as well. And that is what I have, but I think Victoria mentioned, like, we've gone really deep into this, and it's been really great to get a lot of very good ideas out that, and it's both deep and wide. So we'll have our work cut out for us, but I think it's a really good workbook.
Thank you. And I really do appreciate the work of this and the other subcommittees. And in housing, it has been very interesting to see the work of finding solutions that are public-private partnership based. So with that, I will move to the Safety and Training Subcommittee. Maybe Rebecca could.
Sure, I'd be happy to. We've had several meetings as the other committees have, and we do have a really great core group. Again, certainly welcome others to join us so we can have all perspectives. But we've had some great conversations, and I'll go ahead and sort of review, like Lisa did from the workbook, things that we've been focusing on. And the discussion did pick up a lot on the work that had been done prior, and is coming together with more perspective and more in-depth conversation. So we've been focusing on training for law enforcement, specifically talking about what is already mandated in the state and looking at where there might be gaps in that training, whether it's what's covered within the training or the coverage across the state. We've also looking at the mobile crisis units in the state of Maryland, beyond the law enforcement response. Who else is responding in those cases? What is their level of training? Specifically looking at funding and how we can get a uniform mobile response teams across the state, because we know that varies quite a bit across jurisdictions. We're also looking at, again, training for first responders beyond law enforcement. So that's looking at fire, EMS, emergency room personnel, 911 dispatchers and such. So what already exists there in all those different sectors, there are efforts going on in the state, but they are not mandated like the IDD training for law enforcement is. So how do we make that less of a patchwork? And again, what needs to be included in those trainings? So a lot of it is looking at what we're already doing, of course, and that's happening in all the other subcommittees, and then trying to figure out how to fill the gaps. We talked a lot about guardianship and several aspects of guardianship. One focusing on the schools and how oftentimes during the transition process, it is the only option presented to parents instead of the many options that do exist. And so we want to take the position of guardianship as the last resort instead of guardianship as the only resort. We want to look at the current guardianship statute to see where there might need to be some changes within the statute. So that would be a big lift, and that would be something that we do probably through the legislative process. Let's see. Also, let me just look over here. I think that's probably for the guardianship area. Oh no, annual reviews are just looking at so not just the process in the statute, and not just it being the only option presented to parents often, but also looking at the process itself and making sure that individuals who are in guardianship are safe in that placement. How do we make sure year over year that it's the right placement? What happens when the caregiver or the guardian needs to change for whatever reason, whether it's their own health or their life circumstances? How is that process done effectively with the best outcome for the individual? And if anybody on the safety committee wants to jump in, please do. As I move on to the other area is, I'm sorry, it's a long document. Yeah. We talked a lot about 911, and this might sort of be wrapped up in some of the other policy areas, but looking at that process and what's available to across the state, whether it's texting options, how 988 plays into some of the issues around behavioral calls, but a lot about how 911 is dispatched. And we are lucky to have a very experienced person with dispatch on the committee who's able to explain how this works for us, and looking at how the recommendations that that we're coming up with, how that would tie into the state's effort for Next Gen 911, which is the effort to make a universal system and process across the state. Because again, much like mobile crisis, 911 is different in every jurisdiction. So we're looking at some uniformity that could happen under Next Gen 911. Let's see, and then the last 8, I think this is 911, so I'm sure I'm missing something here. And then looking for more opportunities for partnerships with the stakeholders and first responders. Sort of. So I'm going to invite, oh, and then the last thing, which we haven't really, the last area, which we haven't really talked about a lot yet. This is going to be, sure, in coming up meetings. I feel like we haven't talked about it a lot, but I could be wrong, is abuse and neglect in provider controlled settings. So again, how are individuals who are with caregivers, whether that's a provider or a parent caregiver, you know, how are we ensuring their safety, that they're having their choice is what's happening in their day. So looking at that and sort of how the End the Wait campaign and all that or law is going to hopefully help with some of the support services or lack thereof that are available. Nikki or Lisa, would you like to add? And if there's somebody else on safety who I don't see, I think Beth Benavides is here. Anybody want to add?
I think we've had really comprehensive discussions about what you mentioned, Rebecca, and I'm looking forward to having that discussion on abuse and neglect in both home and provider-based and individual. Like when people come in as direct support professionals, that's obviously a really important thing. I don't know if the state has any subject matter experts in this, but if we don't, it might be something we pursue from other states because there really have to be some good options for us to consider.
Okay, so I'm just gonna move us on. The next portion is employment and transportation. Amy Taubenfeld is the official lead on that, and she's one of the great geniuses on the subject. But unfortunately, she couldn't make it due to a last-minute emergency at work. So I'm going to see if anyone else who has been in that committee and that subcommittee can go into depth about that. I can also summarize, but I'd love to hear from others.
I was just gonna say I'm in the committee, but I missed the last meeting, so I would definitely, you know, defer to someone else that attended.
You don't have to attend every single one, so just give your impression.
Well, I'm not sure if I'm on the Employment and Transportation Subcommittee, but I mean, I can give my personal thoughts and beliefs on, you know, the employment and transportation.
Adam. Yeah, sorry, go ahead, but it's more about what is the work of the subcommittee going on. But we can definitely hear you out later. Like, sorry.
Sorry about that, but if that's the case, then sorry, I don't have a clue. Sorry.
No worries. Sorry to interrupt. I mean, to be very honest, a lot of what employment has been discussing is issues like how do we define satisfaction in employment? How do we define services? One issue is around learning how to perform. What data do we have around employment and unemployment? And that's discussing data collection mandates and what data collection already exists in agencies and whether we can engage in such additional voluntary data collection programs like unemployment, a DOL, and so on. Also discussions around public-private partnerships and hiring programs, know your rights materials, around what are your rights, what are the realities, trainings for employers around the benefits of employing people with autism and people on the spectrum, and autistic people. And in the process also things like for example, the state being a model employer that leads by example, and we've even discussed a bit expanding current diversity initiatives around disability in the state, such as how the federal government has done in its workforce with Schedule A model. Other discussions have been around the topics of, for example, ensuring diversity in workplaces, like the ideal workplace for an autistic person can be anything from software engineer at Northrop Grumman to manual work, to certificate, college level. And it also brings us to the topic of direct support professionals, which has been brought up in a whole series of places. And the topic of transportation is very integrated. And one discussion that's being had is things like cognitively accessible driver's education, how to work with driving schools to participate in that. What are ways to make greater accessibility to transit systems? What are ways to expand that into rural areas, and so on. I just want to pass it on to health, and I wonder if any of the more outspoken people from health have been there. Maybe Rachel, I know you were very involved in health. Sorry to call you out. Rachel Leah Krause. But anyone else can also join in.
I just put in the chat. I'm not prepared to speak today.
No worries. I know that autistic feeling of, oh, do I have to talk without planning, without scripting in? That's terrifying, kind of why I prefer to be texted instead of called, but that's more a millennial and Gen Z thing.
Oh no, I'm Generation X, and I think phone calls are like hostage situations.
Yeah, it's kind of rude to be called out of the blue, in a way. But I would say if anyone else wants to chime in, or unless there have been some topics on healthcare around, for example, underrepresented populations, such as how to ensure access to healthcare, and diagnosis and reduction of barriers and discrimination based on autism, diagnosis to adults, women and girls, LGBTQ people of color, how to avoid barriers to healthcare being placed based on autism diagnosis, such as with reproductive care. We see that a lot, like say fertility treatment and so on. We've also seen a lot of discussion around rural health needs, like how to ensure that there are health needs being met in, say, Western Maryland, Shore, how to ensure that we incentivize. Oh, Jess, you want to go ahead?
Oh, sure. I think I stepped out of the room when you switched to health committee.
No worries.
Yeah, I haven't been able to attend all the meetings, but yeah, I mean, I don't have much to add, but yeah, I think a lot of our conversations have been great talking about barriers to access, expanding different modes of support, or expanding expanding access to different kinds of support for families beyond just having like one model. And having that include different options. Rachel just added, oh, that's for the employment committee. That's what comes to mind. Anyone else feel free to chime in.
Yeah, so other things like there are specific ideas like how to incentivize health systems to set up more shop and access in rural areas, and incentivizing medical school graduates and other health professionals to go there. How to incentivize people with autism to enter health professions, like in this, it's the whole spectrum of health professions, not just say medical school, where if you create a pipeline, you'll see the result in 10 years, but things like physical therapists, social workers, and so forth. I want to answer Rachel's question, which is the one topic about when it comes to know your rights and so on, is that we do want to ensure that everybody knows with every person with autism, every person on the spectrum was seeking a job or any job knows what their rights are and what they are in practice, how to navigate an accommodation and so forth. But that is also part of it. I just want to go ahead and we can go into greater detail a bit later. I'm gonna go ahead to the next slide. I just want, this is very brief, but we do have a couple ASGARN vacancies. There is an ex officio spot for the Maryland Occupational Therapy Association. Our understanding is that they haven't opted to participate in this group, but if anyone has contacts there and access to them, you can persuade them otherwise. Please let them know they're continually welcome, and by law, they have a seat. Like, we would love to see them here. There are 2 statutory gubernatorial appointee vacancies. One is by law reserved to a physical therapist and another one to a pediatrician. This is something where I would love to see because they're so specific. We've had some hard time and difficulty finding candidates applying, because imagine applying to a gubernatorial appointment that is unpaid, takes a lot of time. There aren't that many people who are eager to do it at times. So if you know physical therapists who are familiar with our community or lived experience or expertise, if you know a pediatrician, that's one where I'd love to hear parents of pediatricians that might be good to please apply to the governor's office of appointments. I had a pediatrician, but that was 20 years ago. So, and I think the same can be said of every adult. So just keep that in mind and try to encourage such people you think qualify to apply to the governor's office of appointments, and let me know about it so I can talk to the office of appointments, because they usually talk to me to help them review it. I just want to flag the upcoming meetings. Today is March 12th. That's why it's marked with a 0. May 21st is the 4th quarter of the fiscal year. That's the one. Hopefully we won't I won't have, say, jury duty that requires moving it around, but it should be that day. And then we have as the next step, the strategic plan launch, which should be at the end of June. So just put in your calendars, and Ellis will make sure that it is in your Google and Outlook calendars also, May 21st at 1 p.m. to 2:30 p.m. And whatnot, and we will post it on the website. And this is the point for open discussion. I know a few people have wanted to talk, ask questions. I know I've seen people post stuff in the comments, and I realize that sometimes written language is better. And I would ask Ellis to please flag the written comments a bit for me if I need to see them, because the screen share system doesn't really work well for the comment box for the chat. So with that, ASGARN members, what are your comments, thoughts, or as I like to joke, what is your existential dread that you're experiencing? And honestly, if you want to just say nothing and move on quickly, that's okay too, but the space is precisely to talk, and it would be a pity to keep it quiet.
I did just put in the chat that I believe there was a pediatrician in our group previously when ASGARN was housed in the governor's office. So I think that it would be good if we can go back and try to identify who that individual was and look at possibly asking them to reapply.
I mean, definitely. My understanding when we entered was that we pared down ASGARN due to conflicting records of who had been appointed by the coordinator level, was that we pared it down to the statutory members that had been appointed by the governor. So if there was a pediatrician, that person was probably coordinated or appointed at the time. So if that person can be identified and asked to apply to the governor's office of appointments, that would be great.
I have someone who is wonderful, who has been working as a pediatrician for many years, who has insight into how to also train physicians on how to work with individuals on the spectrum, which I think is very important. So let's follow through with that.
Certainly, that is one to follow up offline to an extent. Like, if you come up with a bright name, send it to me, send it to them, try to recruit them, you know. I can go ahead and open it for public comments if people aren't eager or shy. And I just want to say, if you have other ideas, you all have access to the list of members. I generally have been putting, when I address a write to everyone in ASGARN in the BCC, just to avoid reply all apocalypses, I call them. But please feel free to reach out to everyone. Feel free to reach out to me. I like to say my cell phone is right here. You can text me. It's less rude than calling, but I will also take your phone call. But you know. Public comments.
I have a question.
Yeah.
Since you were talking about the physicians, what are the regulations in Maryland for continuing education of physicians and medical staff? And I'm seeing huge discrepancies in understanding that people have been in medicine for maybe 15, 20 years and have never made it through sound modules and understanding more about autism. And how can we also influence medical schools in Maryland to increase the amount of time that they spend on autism? In many medical schools, it was like a half hour's worth of training in classroom. So how can we work on that and investigate that? Because I think it's very problematic.
That is a topic that has been recommended a lot in the healthcare committee, the subcommittee, because so a lot of the discussion is precisely around the education of healthcare providers. And I mean, the first step would be obviously to evaluate what is the existing education, especially as continuing in, and to what extent that is even fully in the case. Like, I'm familiar that in the legal profession, attorneys in Maryland do not have any continuing ed in Maryland, which is terrifying. Like, once you get admitted, you just pay the dues and are in. But I would say that in the other part, that would probably, there is the discussion of whether that should be a legal mandate at MDH or at the General Assembly, or whether it should be more worked with, like accrediting agencies and licensing agencies and commissions to ensure that this is worked out into the continuing ed curriculum, into the medical school curriculums, and so on. One example that I have brought up is how in the District of Columbia, there is a mandate by law that there be LGBT literacy education for healthcare providers, and then it leaves up to the licensing authorities of each profession to implement what that looks like in each profession. But yeah, Alyssa's texting me that they have a question from the chat. Could you bring it up?
Absolutely. Thank you so much, Victoria. This is Alice. I'm reading from the chat. We have a question from Rachel Leah Kraus. Rachel is asking for the employment committee, has there been any discussion on assisting autistic folks in competitive employment and getting their needs met through accommodations, as well as how to navigate if their rights have been violated or are being discriminated against? This is something my folks come up against frequently. And before I hand this off to you, Victoria, I would like to mention that there's a really wonderful resource. If you go to AskJAN.org, that's something that's been created by the federal government. It's paid for by the Office of Disability Employment Policy, the Department of Labor, and there are a wide variety of accommodations that you can just look. And it's really great because it will tell you different accommodations that are available. So that might be available to people.
So yeah. So as far as Rachel Some of the discussions have been precisely around education and assistance when it comes to what to do, both enforcement of legal rights.
Wait, Victoria, I'm getting a correction from Rachel. There was another part that I didn't include, so I'd like to share the full context if that's all right.
Yeah.
I apologize, that's my mistake. So Rachel is actually asking more about advocacy services similar to those in the health committee to assist folks in navigating.
I do not remember that off the top of my head. As far as advocacy, like say how you'd have a caseworker or a medical advocate helping you navigate that process. I think it is worth bringing up, and to an extent I want to ensure that each subcommittee recommendation cross-pollinates with each other. And I kind of came to that conclusion with how, for example, there is so much discussion in each subcommittee about direct support professionals, often with the same ideas. So I really want to make sure that we have similar ideas to what we're talking in healthcare and employment, basically. But I do not remember how deep we've gone into that. I also want to add that Rachel tried to answer Jalen's question on healthcare, that on pediatricians, that it is something that we have specifically written, and that it is most important also to learn from professionals in the field who are autistic, like autistic healthcare professionals giving those trainings. And there's also been, I remember, the discussion of how to establish more of a pipeline recruitment for professionals into healthcare settings who have autism and are on the spectrum. What are other thoughts? And I'm starting to see that some people are having to log out, but we're moving into public comments. And after that, I would go into closing remarks. I'm gonna leave the slide
Victoria?
here, but I want to hear, yeah.
Sorry, my hand is up. Is it okay if I just hop in really
Yeah,
quick?
go for it. I don't want to close it yet. I will still have a whole half hour. I just ended up clicking on the slide by accident.
No problem. No problem. Thank you all. This is Lisa. And just wanted to jump in on the job accommodation navigation. Victoria hasn't mentioned it. She probably isn't authorized to talk about it just yet, but I can talk a little bit about some of the work that we're doing in this space. I'd like everyone, especially those on the employment subcommittee, to take a look at the state as a model employer initiative that's being pushed at the federal level. We're looking to bring some of those recommendations here to the state of Maryland, and our department is working hard to bring some of those policies here to state government, so that state government can serve as the model for the private sector when it comes to employing those with disabilities and creating pathways to bring more people with disabilities into competitive integrated employment. So a large piece of that is the accommodation work and elevating the awareness of accommodations, but also helping people identify reasonable accommodations that they can utilize to make them successful in these positions. So a lot of work is being done. We can't talk specifically about what we're looking to do just yet, but anything that can be echoed in this space when it comes to the strategic plan will only help us bring this work to fruition. So again, if you're on the employment subcommittee, I would love it if you guys could take a look at the state as a model employer initiative and try and weave that into the work that you're doing as a subcommittee. Thanks so much.
Just to ask in the chat if you could spell out the name of the initiative.
Thanks, Alice. I appreciate it. And yes.
Okay. Any other questions, comments, thoughts? Adam, you unmuted yourself. I know you wanted to talk. Sorry about interrupting you that time.
Yeah, I have just one question, and it refers to the health subcommittee, actually. I've been worried that for their health purposes, if they're feeling like, feeling depression or anything like that, is the state going to provide like this right caregivers or the people for them that can handle those, those kinds of conditions for people that are on the spectrum? I mean, because every condition can differ greatly, and I'm just a little uncertain as to how the state is planning to be able to assign the right people to those individuals to make sure that they get the correct care and guidance that they need, so that way that they stay, healthy from a mental standpoint and an emotional standpoint.
Yeah, a common barrier that has been identified in the health committee, and others can chime in, including those who have already done so, like Rachel and Jess, is precisely around how in co-occurring conditions, often they get seen distinctly, often negatively through the lens of autism of, oh, let's forget about all the other mental health conditions you might have because you're autistic, and everything must be because you have autism, whereas you can also say be bipolar or have depression or have trauma-based issues and so on. And that also involves treating all those co-occurring conditions, involves familiarity with how they all manifest in someone on the spectrum, and also what treatment looks like in said cases. And the same applies with physical health, like ensuring patients are believed instead of not because of negative stigma when the person says, I'm hurting all over and we can't easily find a cause, and so on. So yeah, I don't know if others from the healthcare subcommittee want to talk. And that's why there is such a need for education, and even for that matter, in other issues like removing barriers. Jess. And Greg also has their hand raised.
Okay. Yeah, this is Jess. Yeah, I'd also add that I think often too, there's just a barrier in terms of a lot of practitioners not having a neurodiversity affirming perspective of care, and actually just not even affirming folks who are seeking evaluation for an autism diagnosis, who and this has a lot to do with gender, right? Just like the sheer number of women and girls who are overlooked because they don't fit the stereotypical diagnostic models for autism. So I'm too thinking about, like, I think often that can be affected by just a basic, like, do you see me as an autistic person, right? So instead people might really push you towards like maybe what you need, push you towards other diagnoses or other labels or other treatment methods that could be helpful, right? But they're not seeing the whole picture, and they're not seeing autism as a central part of that picture. And so I think that too, I guess, I'm not sure where that leads us, but that is absolutely a factor with all of this as well. And I'll hand it over to Greg.
Yeah, the other thing I just wanted to add that we have discussed in the health subcommittee is that another barrier related to this is lack of provider competence and confidence and willingness to serve individuals with autistic individuals, especially if they have co-occurring intellectual or communication disabilities. So I think one thing we've really tried to focus on is both ensuring that there are mental health providers who are trained and competent and willing to serve our community, but also and sort of looking for opportunities to enhance those, as well as ensuring that there are mental health providers available, period, given that we're also talking about rural communities where there may be a limited pool of providers to work with. So those are all things that we have discussed in the subcommittee as things that we're concerned with and focusing on as well. So.
Anyone else? Jalen, you are unmuted, so I'm trying to see if you wanted to say anything.
Actually, I do have a question. We were talking about physicians a few moments ago. There is something that has come up in the IAC meetings, and there's a bit of momentum happening across states. And it might be very important to include Maryland. It would be important to include Maryland on this. in looking to inform judges in much the same way we're talking about informing pediatricians. If there are subsequent things that can be done along the way to let judges know, especially in sentencing, because we're taking care of many things with police officers and first responders and so forth. But if somebody finds themselves in the courtroom, very often judges don't understand the subtleties of autism as opposed to other types of criminal behaviors and other types of motivation. And when somebody is maybe having a meltdown and something occurs as opposed to intent for something to happen. There is a bit of an appetite out there to have some of these things addressed. There have been several different situations that have come out of courtrooms where there are sentences that are imposed that may be unduly deserved or in many situations. And people are also utilizing the statement of maybe we are substituting institutions of the past for current institutions, and that would include penal institutions. So just tossing that out there for a bit of thought. I don't know, it kind of crosses a lot of boundaries. It goes into public safety and so forth, but I'd like to know more where the judiciary in Maryland stands on the continuing education too for judges.
Yeah, that would have definitely, obviously, that's one where I wouldn't recommend a mandate because at least at the General Assembly level, because the judiciary wouldn't like being regulated from outside, and the legal profession is very self-regulated. But what I would say is that there has been a fair amount of discussion, especially in the guardianship context, about educating judges from relevant courts, the guardian ad litems that work on it, and attorneys that work on it, on those topics. So the extent to which it makes sense to push it into the penal system and in general is something that is essential. Rachel, you have your hand raised.
Yeah, thank you. Can you hear me? Just a thumbs up. Okay, cool. I just wanted to respond to that by saying that that exact thing is in the council's 5-year state plan. We actually have a whole objective to work with Disability Rights Maryland and the Maryland Center for Developmental Disabilities to develop information, resources, and trainings for judges, attorneys, others in the criminal justice system, in the court system, but also the, larger criminal justice system. So far, we've got it going with correctional officers. So that's sort of the next step, not what Jalen's talking about. But we've had really, really, really productive conversations with the head of the judicial training, whatever they're called. There's some official name, I don't remember it. About objectives and training, developing the objectives and the training about people with intellectual developmental disabilities, including autism, for judges that they would then, because they were so interested, have as a training that was potentially required. So we're making baby strides in Maryland, much more work to do. We've also had conversations around how we can do that with the public defenders and the state's attorneys. And I don't think we can go out and train all of the lawyers everywhere that might come, but we can start with the state folks at least. So we are on it.
Good. Would you be interested in continuing in conversation, because there's some people that are with the Department of Justice that are interested in this as well, along with other providers and people in the field? It might be good to have a strong Maryland voice in this.
Sure.
Okay.
Happy to. Thank
All
you.
right. Can we connect then after this? I'd appreciate it. Thank you.
Yay, connections. I know Lisa Wheeler is talking on the chat, and in case she wants to bring it up. And I just want to say, for example, the topic of what happens when the person with autism is the criminal defendant, is the arrested, is the person who may or may not have committed the crime, since we have presumption of innocence, or is incarcerated, doesn't seem to my memory to have come up that much in the safety subcommittee. But that also brings us to the topic of, oh my God, there's so many issues that could be touched. And I might still be able, and I would still be able to touch it on the strategic plan once I'm writing in myself. But that is also in the, how do I pare this down to a series of issues in the strategic plan, despite having so many ideas, amazing ideas. But Lisa, do you want to say anything, since I know you were in the chat?
Thank you. Rachel has said that thankfully they've been in discussions with the ARC headquarters in Washington, D.C., which they're actually grant funded out of the federal government. So I'm surprised DOJ hasn't talked to the IACC about this, that they have this National Center for Criminal Justice and Developmental Disabilities, and they've been focusing a lot on this area for many years. So Jillian, you might want to like maybe Google that and send that to IACC if they're not familiar with it, but DOJ might even want to, I don't know the money comes from DOJ, but they're a really good resource. They've been looking at best practices nationally for a lot of years.
Yeah, and like I said, for example, just guardianship alone, which we've talked a lot about in public safety, would be a huge lift in terms of reform. Criminal justice reform is a whole ball of wax that, like I said, I wouldn't discard touching it in the strategic plan, but that it's like so many bright ideas, and I'm having that. How do I put so many, like, if I integrated everything that everyone has brought that is worth touching, I would have like 200 pages, and I don't, we'll get there, don't worry, but I'll figure it out. It's 2:16. I want to move us on, if at all possible, since we're getting there, just unless anyone wants to, say their piece out of the blue, like anyone has anything urgent to say. And even if they don't, just send me, my email will be on the last slide, and most of you already have it. So as closing remarks, I just want to thank everyone for coming. I just want to thank everyone for making this such a pleasant meeting. I'm gonna keep it short because I know that not that you don't live, that the thing you have as the biggest goal in your life isn't to sit through a government meeting and hearing me talk, but I just want to thank everyone for making this possible, the strategic planning process possible, the vision and mission process possible, to ASGARN for being so helpful in creating ideas that we can use for the strategic plan and so on. So I really do look forward to seeing you on the 21st, all of them on the 21st of May as one body. And I also do look forward to seeing everyone in the various subcommittees over the next few weeks, since we have like another month of subcommittee meetings. So with that, just the contact us information, I'm gonna write in the chat my email address in case anyone wants to copy and paste it and doesn't already have it. And with that, I just want to see if anyone has a motion to adjourn.
This is Lydia. I move to adjourn.
I second.
Moved and seconded. Are there any objections? I can have the motion pass viva voce by live voice. So with that, we are adjourned. Thank you very much, everyone. And like I said, I'm always available.
Thank
Thank
you,
you.
Victoria.
Thanks, everybody. Have a good afternoon.
Thank you for your leadership.
Thank you very much.
Thank you.